Well, good afternoon, everyone. I want to start today by recognizing the historic nature of recent days where, in an overwhelming margin in the popular vote, Americans voted for national leadership dedicated to decency, unity, kindness, and equity, and in doing so, made history by electing the first woman, the first black woman, and the first South Asian American to the vice presidency of the United States. I'm really very, very proud to be a member of a party committed to building representation and a better tomorrow for all people. This wouldn't have been possible without the community leaders and organizers of all stripes across the nation, people of color and young people in particular, who secured the right to vote for themselves and their neighbors, who looked out upon this country's leadership over the last 4 years and said, I know we can do better than this. But today is even more about action than accomplishment, because the president-elect is a good and decent and empathetic man who comes prepared for national leadership with real plans to address this economic pain, to battle this pandemic, and to defend our healthcare workers, and when the time comes, to ensure that a safe and effective vaccine will be made available to all Americans. I'm so very pleased to see, as one of the president-elect's first acts, the announcement of a COVID-19 task force with experts committed to the sorely needed national action on this issue. Make no mistake, the weeks and months ahead in our fight against COVID-19 will remain phenomenally difficult. But specifically here in Illinois, we will persevere and we will continue to work with the federal government, soon with at least one fewer major impediment. On to our COVID-19 update for Monday, November 9th. As the weather turns cooler and more activity is driven inside, we may have a real problem on our hands. And the national experts at Johns Hopkins, Northwestern, University of Illinois, and other leading major healthcare institutions say it's only going to get worse. They've challenged Americans to recognize that we're at war and to act accordingly. Our new daily cases are up nearly 380% since October 1st. Our statewide test positivity is up over 180% in the last 5 weeks. And both our statewide COVID-19 hospitalizations and deaths per day are up more than 150% in the same time period. The virus is winning the war right now. The situation has worsened considerably in certain areas of the state, with massive increases in the rates of community transmission, specifically in 3 regions. As a result, regions 5, 7, and 8, that's Southern Illinois and Chicago's south suburbs and western suburbs, will join Region 1, Northwestern Illinois, in Tier 2 of our resurgence mitigations starting Wednesday. That means a prohibition on gatherings of more than 10 people for both indoor and outdoor gatherings, additional restrictions on sporting and recreational events, and tightened restaurant and bar table caps of 6 per party. The exact mitigations, if you want to read all of them, can be found on DCEO's website. Let me explain the severity of the trajectory in these 3 regions as starkly as possible and as specifically as possible, and I'll start with Region 5, Southern Illinois. Today, Region 5 is seeing an average positivity rate of 11.5%. In mid-June, that rate dropped as low as 1.3%, and on average today, more than twice as many COVID-19 patients enter a hospital each day in Region 5 than in late August, the summer peak. Regions 7 and 8 share in this unfortunate trajectory. Each now has a positivity rate above 13%, meaning just about 1 in every 7 tests in these areas is coming back positive. Per the WHO, the benchmark for reopening is no more than 1 in every 20 tests. Mitigations are only effective if they're followed. Too many local officials across the state are ignoring their local public health departments and doing nearly nothing to assist their residents in following even the most basic COVID-19 guidelines. Some elected leaders are allowing this continued rise in positivity to balloon out of control while taking no action. These mayors and city councils and county boards and state's attorneys need to take some responsibility for keeping their constituents safe. I promise them that responsibility pales in comparison to what could come when the hospitals in your area are filling up and there aren't enough nurses or doctors to save their constituents' lives. The end goal of mitigating the damage the virus is doing to people's lives is this: keep as much of our economy and our schools as open as possible in a safe manner, and when risk rates in the community surge up, take meaningful action to bring things down in order to protect ourselves and the people that we love. One last thing. If you see something, say something. If you see someone, a friend, a coworker, or an acquaintance who's not wearing a mask, remind them that it's for their own good to wear one. You care about them, and that's why you're nudging them. We have to look out for one another. This is one important way to do that. So thank you, and now I'd like to ask Dr. Ezike to give a report for the Department of Public Health. Doctor.
Thank you, sir. Good afternoon. What's the message? It's the same. Wash your hands, watch your distance, and wear your mask. I know it sounds like the same message, but we'll continue to reiterate the same message because it is these exact actions that will help us slow the spread of COVID-19. We all want an end to this pandemic. We are all on the same team. We want to be able to hang out with our friends. We want to enjoy our favorite restaurants. We want to have our large weddings and all the other things that have been sacrificed since March. But there's only a few paths to get us there. And one is by reducing the amount of virus that's circulating so that we no longer see sustainable spread. And we do this by limiting our group sizes as well as wearing our mask and keeping our distance. Unfortunately, there are significant number of people who are not following this recommendation, and by not doing these things, the virus just continues to get ahead of us. It continues to spread, leading to more and more cases, more and more hospitalizations, and unfortunately more deaths. The other path is to have a vaccine. Let me not say that, not to have a vaccine, but to actually have vaccination. There is a difference. We can have hundreds of millions of doses of vaccine in the world, but if they don't get into the arms of people, it's not helpful. There are several different vaccines for COVID-19 that have been developed and are going through clinical trials. You may have heard of some recent updates today. There are people who are hesitant about a new vaccine and feel that the process has been rushed. The difference with the development and testing of the COVID-19 vaccine in comparison to other vaccines is that every possible resource has been thrown behind the creation of this new vaccine. The U.S. government has doled out billions to move vaccines through the requisite phases in record time. In fact, the whole world, not just our government, the entire world is focused on a safe and effective COVID-19 vaccine. The review of laboratory and clinical data that is used to ensure the safety and effectiveness of any vaccine is still being followed. And this includes review by the Institutional Review Board, which is a diverse group of clinicians, scientists, and community members. For people who want to learn more about the vaccine process, I urge you to research further the FDA vaccine approval process and look up more information from the National Institutes of Health. These are the paths that we are pursuing, and hopefully we can get to less cases, which means less hospitalizations and finally less deaths. Today, unfortunately, we're reporting another 10,573 newly identified cases of COVID-19 for a total of 498,000 560 total cases in Illinois. That includes reported additional 14 deaths for a total of 10,210 lives lost to this deadly virus since the beginning of this pandemic. Overnight, there were 4,409 individuals in the hospital with COVID-19, and of those, 857 were in the ICU and 376 were on ventilators. In the past 24 hours, 64,760 tests have been reported for a total of more than 8.4 million tests. So until we have a safe and effective vaccine in most people's arms, let's continue to wash our hands, watch our distance, and wear our mask. And just another reminder, because I know this comes up and I know there might be some confusion, if you are identified as an individual who was an exposed contact of someone who tested positive, running out and getting a test does not end the quarantine. You cannot test out of quarantine. So remember, it's still 14 days for quarantine after your exposure. It can take up to 14 days to develop the symptoms of the disease if in fact you caught it. And now I will translate the comments in Spanish.